Hello, and welcome to our session, Meditation, Mindfulness, and Movement. I am Laura Devitt, Director of Programs at the Pulmonary Fibrosis Foundation. I am pleased to introduce today's speaker, Renee Fletcher. Renee's nursing career spans more than 40 years, which includes 30 years as the Director for the largest cardiopulmonary rehabilitation program in South Texas. She currently works in a surgical admission and discharge unit and also has experience in neonatal intensive care and pediatrics. Renee's holistic focus has led her to become a Healing Touch certified practitioner and an instructor in training. Healing Touch is an energy therapy in which practitioners consciously use their hands in a heart-centered, intentional way to support and facilitate physical, emotional, mental, and spiritual health. Renee also teaches focused awareness meditation in her role as patient educator for cardiopulmonary rehabilitation and through her business, Simply Health with Renee. In addition, Renee uses orthobionomy, emotional freedom techniques, and HeartMath during therapy sessions when needed or requested. She makes and sells handcrafted lip balms, lotion bars, deodorants, and other body care products with all natural and organic ingredients. Renee is eager to assist you to health, Simply Health. Welcome, Renee.
Hi, my name is Renee Fletcher. Thank you for joining me for this presentation, Illness, Stress, Mindfulness, and Resilience. I'd like to start out by telling you a bit about me personally. I had a bit of a dysfunctional upbringing. I had some significant emotional and physical challenges in my early teens and early 20s, to include a severe eating disorder. I ended up with chronic fatigue syndrome in my late 20s, which lasted about 3 years. I eventually married. I have 2 children, and I continued to barrel my way through life by getting a master's degree in nursing, and I became the director of cardiopulmonary rehabilitation, a role that I kept for 30 years. So I have been in this very much in control type of personality, and I had no time to manage my own stress. But then in 2009, I was diagnosed with ulcerative colitis. So ulcerative colitis is an autoimmune disease. It affects the colon, and it increases the risk for colon cancer. The symptoms are bloody diarrhea, weight loss, dehydration, malnutrition, and above all, fear. So at that point, I was no longer in control of my body, but it ended up being a blessing in disguise. It actually started my journey to learn self-care and resilience. So the dictionary definition of resilience: the capacity to recover quickly from difficulties, the ability of a substance or object to spring back into shape, elasticity. Psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Becoming resilient not only helps you get through difficult circumstances, it also empowers you to grow and even improve your life along the way, which is what I feel I have been doing. So what is this process of adapting well? I'm sure there have been times in everyone's lives when we did not adapt well. So I feel there are physical, emotional, mental, and spiritual components to adapting well. So let's talk about some of these resilience strategies or hacks. So the first is a healthful eating style. And my definition of healthful eating is organic and as fresh as possible, severely limiting processed foods. If we're not well nourished, we will not be able to care for ourselves. And because everyone has different needs, I would encourage you to seek out a nutritionist. But I do have some basic recommendations for healthful eating. So number one, healthy protein and fats, fresh, low starch vegetables, fresh, low sugar fruits, nuts and seeds, pasture raised eggs, grass-fed meats, omitting anything with sugar. Sugar is highly inflammatory, sufficient water, and reduce or eliminate alcoholic beverages. So basically, this is an anti-inflammatory eating style. Most, if not all, of our chronic diseases are due to inflammation. So reducing the inflammatory foods in our diet sets us up for physical resilience. So the next resilience strategy is exercise. And again, everyone has different needs and capacity for exercise. And I encourage you to talk to a trainer and or attend pulmonary rehabilitation. So again, I do have some basics. Number one is do something aerobic, which means getting the heart rate up. So that could be walking, running, biking, swimming, those types of exercises. Also do muscle building, strength training. It helps to maintain our muscle mass, and it also helps to prevent bone loss, osteoporosis. And also do flexibility or stretching type exercise. It helps to prevent falls. So the next resilience strategy is sleep. If you don't do anything else that I talk about today, figure out how to get a good quality night's sleep. There are many sleep hacks out there. Here are a few. So shoot for 8 to 10 hours of quality good night's sleep. How to do that? Watching the sunrise and the sunset, that helps us set your circadian rhythm for a good sleep. Avoiding artificial light, using the Wi-Fi after sunset. Do not eat 3 hours prior to bed. Sleep in a cool and dark room, and no caffeine after 2 p.m. Again, there are many other sleep hacks. I would advise you to seek them out. The next resilience strategy is earthing or grounding, getting out in nature. The earth has electrons that we absorb through our body. And because of that, that electron exchange, research has shown a decrease in inflammation in our bodies. So consider at minimum 20 minutes of being barefoot outside, getting your feet or your body in grass, dirt, pebbles, sand. I'd also encourage you to watch the Earthing movie. You can find that on the internet. And I have the website listed, earthing.com, for more information. The next resilience strategy is building connection, prioritizing your relationships. So how do we do that? Accepting help and support from others. It benefits both of you. Do not isolate yourself. Join a group. This Pulmonary Fibrosis Committee may be serving as your connection to community and serving others and being served. And also create a sense of joy in your life. Find ways to do that. Very important. And the next resilience hack is finding purpose. Finding purpose in your life by helping others. That could be a friend, helping out at a homeless shelter, animal rescue. There are many options. And then setting goals, keep moving forward, even if it's only a little at a time, just keep moving. And I always like to recommend to seek professional help if you feel that's needed. And last but not least, a resilient strategy is stress management practices. When we learn to manage the stress in our life, we allow ourselves to live in an optimal state for physical, emotional, mental, and spiritual healing, well-being, and resilience. So some options are yoga, tai chi, qigong, journaling, prayer, meditation. The list just goes on and on. So simply find a practice that resonates with you. One practice that I would like to recommend that you try is emotional freedom techniques, or EFT. It's also called tapping. We believe EFT helps to neutralize trauma stuck in the body. It involves tapping with your fingertips on acupressure points on your body, and these are some of them. Research has found EFT to be extremely effective for issues such as phobias, depression, anxiety, PTSD. There is a layperson's version that you can learn on the internet. But truthfully, EFT is best when it's used with the help of a trained professional. So my training is through ACEP, which is the Association of Comprehensive Energy Psychology. And I have the website up on the screen. And you can go there to find a professional to help you as well. So another stress management practice that I recommend that you try is HeartMath. And I'm also going to take you through a session of HeartMath. So HeartMath is learning to change your heart rhythm pattern and to create physiological coherence, which is a scientifically measurable state characterized by increased order and harmony in our mind, emotions, and body. This allows us to respond to daily challenges with more ease, awareness, balance, and clear discernment. So I have the website posted. And now I'm going to take you through a HeartMath practice called heart-focused breathing and quick coherence technique. It combines breath work and imagery. So the first thing I want you to do is to think about a disruptive feeling, a disruptive emotion that you might have today or that you've recently had. It could be stress, anxiety, worry, tension, frustration. Just pick something that you're feeling right now and rate it on the SUD scale, subjective units of distress scale. So on a scale from 0 to 10, I want you to give it a number, 0 being I'm not feeling that disruptive feeling at all, or 10 is this is the most disruptive I've ever felt, the most intense I've ever felt this feeling. So basically, the first number that pops in your mind is typically the correct number. So provide a number for that disruptive feeling. And now I'm going to take you through a HeartMath session. So I'd like you to rest your feet on the floor if you can. Head, neck, and spine in alignment. So sitting up as straight as possible, but mainly just be comfortable. Hands resting on the front of your thighs. If you can close your eyes, please do so. If that's uncomfortable, just stare softly, gaze softly at an object in front of you. And if you can seal your lips, meaning breathing in and out through your nose, and if not, that's also quite fine. So now I want you to simply find a nice rhythm of your breath, breathing in and out as comfortably as possible. And if you can, make it a little bit slower and a little bit deeper than typical. A little bit slower, a little bit deeper. And if you can, in and out through the nostrils. And now I want you to use your imagination, move your awareness to the center of your chest, your heart center. And imagine it is your heart that's doing the breathing. So you're inhaling through the heart, and then the heart is exhaling. So take a few moments and allow your inhalations and your exhalations to be through that heart space. And now I would like you to imagine a person, maybe a pet, that provides to you unconditional love. And pull that feeling of unconditional love into that heart space. And where else are you feeling that unconditional love? In the chest, in the abdomen. Are your shoulders relaxing? Is there a smell associated with that unconditional love? A taste, a touch, a vision, a color. So again, breathing in and out through the heart space, filling that space with the feeling of unconditional love. Breathing a little slower, a little deeper than typical. The breath is flowing in and out through the heart space where you're holding that unconditional love. That feeling, that presence of that person, that pet that provides that for you. A little bit slower, a little bit deeper than typical. Just take a few more moments, putting that sensation, pulling that into that heart space. And now start deepening your breaths and coming back to the room. You might need to wiggle your fingers and your toes. And when you're ready, open your eyes and look around the room. Find something blue. Now find something that's red. Find the largest object in your room. Now focus on a very small object. And now look at your clothes. What color shirt do you have on? Bringing your awareness fully back into your body, into this present moment. And now I invite you to rate that disruptive feeling that you rated prior to us starting. I hope that intensity shifted for you and that number came down with this practice. And I hope you found these tips and tools to be helpful for you Thank you for spending this time with me, and have a great rest of your day. Hi, my name is Renee Fletcher, and thank you for joining me for Building a Mindful Brain. So mindfulness, the dictionary definition is the quality or state of being conscious or aware of something. A mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, bodily sensations, and it's used as a therapeutic technique. So how do we get to this state of being conscious and accepting in the present moment? Which also means that we're not focused and worried about the past or the future. So I'm learning this state of being conscious and accepting through focused awareness meditation. It's an evidence-based practice designed to help you relax and decrease your stress level by balancing the nervous system. It connects the physical, emotional, mental, and spiritual body through a focused awareness on your breath. So we'll be talking a lot about breath from here on out. My instructor is Dr. Susan Taylor. I have her website up on the screen, and I'm board certified to teach focused awareness meditation. So in a few minutes, I'm going to be voice guiding a systematic relaxation session. But first, I want to teach you diaphragmatic breathing. So the diaphragm is a big muscle, and you can see that in the diagram. It separates the chest cavity where the heart and lungs reside. It separates it from the abdominal organs. The diaphragm is connected to both sides of the rib cage, as well as to the spinal column in the back. So when we breathe deeply, meaning we're pulling that air in, it goes all the way down into the very bottom parts of our lungs. The diaphragm gets pulled down. It's helping our lungs expand with oxygen. When that diaphragm gets pulled down, our rib cage expands and our belly tends to pooch out. When we exhale, the diaphragm comes back up, our rib cage comes back to neutral, and then our belly softens. So how do I teach diaphragmatic breathing? So I first want you to put your right hand on your upper chest and your left hand on your lower abdomen, right around where your belly button is. Most people have learned to breathe with their upper chest only. So you end up with a breath that's very chest oriented. Very little air is completely filling that lung space. So your diaphragm is not moving much and your rib cage is not moving. So what I would like for you to do is to focus on allowing that breath to come all the way down to the left hand, where you have that left hand on your belly. Try not to allow your chest, your right hand, to move at all. So with the next breath, bring that breath all the way down, moving that belly. You should feel your rib cage expand, and then exhale. Try that again. That may be difficult for you. For most people it is. We were born belly breathing. So watch a little baby. You can watch their bellies move up and down. But as we grew older, we grew out of our toddler years, we started breathing more with our upper chest. So to give you a better practice on how to get that sensation of diaphragmatic breathing, I want you to take your hands and wrap them around your waist, but be able to feel your lower rib cage. Once you can feel that low rib cage, I want you to bend over as far as you can. You may want to stand up and bend your knees a little bit to help you bend over. And as you're bending over, what we're doing is we're getting our chest out of the way. So now as you're bending over, take a deep breath. You should feel your rib cage expand. And then exhale, the rib cage comes back to a neutral position. So stay down there and do some more breaths where you're expanding the rib cage. As you inhale and then you exhale, the rib cage comes back to neutral. So now I want you to slowly sit back up, trying to keep that breath coming down into that lower rib cage, abdomen, as we're moving our diaphragm. So you may need to practice that before that becomes more natural to you. So I encourage you to do that. Make just using your diaphragm to breathe a daily practice. We actually want it to be our default breath. At 24/7, we are using that diaphragm to breathe. And I'll be telling you why here in a few minutes. So why am I making such a big deal about the diaphragm and diaphragmatic breathing? It has to do with the vagus nerve. The vagus nerve is the longest nerve in our body. It's the 10th cranial nerve. It's also called the wandering nerve, and you'll see why here in a minute. So as you see on the slide, the vagus nerve starts at the base of our brain, and it's coming from that area, and this is where it starts to wander. It affects the muscles in our neck, and as you look at the slide, it's coming down and it affects all the organs that you see. So the vagus nerve is in green, and it's affecting not only the neck muscles, but the heart, lung, liver, spleen, kidney, colon, small intestines, going all the way down into that gut area. And as I explained before, the diaphragm separates the chest cavity from the abdominal organs. So in the diagram, right under the heart and lung is the diaphragm. So you can see that the vagus nerve would run straight through that diaphragm. And just to back up a little, why that is important. So we have a sympathetic nervous system, which is called our fight or flight nervous system. So when we're in a state of stress, and if you think back when we were cavemen, the caveman's walking around picking fruits and berries and nuts, and he has no stress at all until a saber-toothed tiger comes along. Well, when he sees a saber-toothed tiger, he has only a couple of options, and that's why we call this fight or flight. He can fight off the tiger, or he can flight, he can flee, he can leave that area. In order to do that, we have to activate our sympathetic nervous system, which means adrenaline and hormones get released. Our blood pressure elevates, our heart rate increases, our breathing speeds up, our blood sugar rises to give us more energy, our blood clots more easily in case the saber-toothed tiger catches up with us and takes a chomp out of our arm. Because our blood clots easily, we might still survive. Our entire nervous system is activated. And that's how we're able to either fight or flee the saber-toothed tiger. So let's assume that he does one or the other. So now the nervous system goes back into a rest or digest mode. So all those chemicals and hormones go back to where they belong, and the caveman goes back to picking the fruits and berries. So unfortunately, we have learned to react this way in our modern day world to so many events in our life as though they were saber-toothed tigers. So think about a mailbox full of bills, issues with our kids, our grandkids, the traffic, even a broken coffee pot. You get the idea. It sets us up for fight or flight. So our bodies react as though the broken coffee pot is a saber-toothed tiger. So going back to our vagus nerve, we can learn to control this reaction to traffic, the broken coffee pot, all those stressors in our everyday life, by using our breath. And by using our breath, what I mean is we're using that diaphragm. We're using that diaphragmatic breathing, bringing that breath all the way down into the bottom of our lungs space to allow that diaphragm to move. So what's happening when we move the diaphragm, we're also activating that vagus nerve. The beauty of the vagus nerve is that it activates the parasympathetic nervous system. So if the sympathetic nervous system, that fight or flight, if you imagine it as being putting your foot on the gas pedal to cause your heart rate to go up, your blood pressure to go up, your blood sugar to go up. So that's putting your foot on the gas pedal. The parasympathetic nervous system, or activating, one way to do that is to activate the vagus nerve. It's like pulling your foot off of the gas pedal. So what happens is the heart rate comes down, the blood pressure comes down. Our blood doesn't clot as easily. So we can go into that rest or digest mode. So I encourage you to practice diaphragmatic breathing, learning to activate the vagus nerve to put you in rest or digest, to allow yourself to pull your foot off of the gas pedal. And you can literally feel your blood pressure and your heart rate come down in some instances. Learning how to use diaphragmatic breathing has truly saved my life. It's a great tool for building resilience. So now I want to take you through a systematic relaxation exercise. Before we do that, I'd like you to feel your body and notice how much stress you're feeling in your body. And I want you to put that on a scale from 0 to 10. 0 is I'm not feeling any stress in my body at all. And 10 is I am feeling the most stress I've ever felt in my life. So again, the number that pops into your mind, the first number is typically the correct number. And so I would like you to start this systematic relaxation exercise by sitting up in your chair, eyes closed if you can. If that's uncomfortable, just gaze softly at an object in front of you. And if you can seal your lips, meaning you're breathing in and out through your nostrils only, I encourage you to do that. And if not, if that's difficult for you, you don't have to. Feet flat on the floor if you're able to, and directly under your knees. Allow your eyes to look straight ahead and then close them. And rest your hands gently on the front of your thighs. And now I want you to breathe comfortably. Nothing fancy about your breathing, just whatever is comfortable for you. Everybody's going to have a different level of comfort with their breathing. And then if you can, make it a little bit slower, a little bit deeper than typical. If you feel that diaphragmatic breathing is easy for you, if you don't have to think much about it, please go ahead and do that. Helps, again, to activate that vagus nerve. If that's not comfortable for you today, continue to practice it after we leave here. But instead of focusing on diaphragmatic breathing, I would just rather have you listen to my words. So check your body once more. Are you sitting comfortably? If not, wiggle around and get comfortable. Because I prefer after you get comfortable that you not move your body again. Just allow your body to be in a very rested state. Allowing those deep breaths in and out. And now I invite you to relax by going to the top of your head and allow your forehead to soften. Soften your eyes. Relax your cheeks. Relax your nostrils, as well as the base of your tongue. Soften the corners of your mouth. Relax your jaw and your chin. Relax the neck. And without physically moving your shoulders, just sending your intention to your shoulders and allow them to relax. And doing the same with the rest of your body. Move your awareness to your upper arms, allow them to relax. Relax your lower arms, your wrists, your hands, your fingers, and your fingertips. Now be aware that you are relaxed from the fingertips to the fingers, the hands, the wrists, lower arms, upper arms. Shoulders and neck are relaxed. Now move your awareness to your heart center, the center of your chest. And as you exhale, exhale all that does not serve you today. You might be exhaling frustration, worry, anxiety. Just allow it to exhale from your body. And as you inhale, inhale a sense of peace, a sense of calm. And now move your awareness to your lower abdomen and hips and allow them to relax. Relax your upper legs, your lower legs, your ankles, your feet, your toes, and relax the tips of your toes. Now be aware that you are relaxed from the tips of the toes to the toes, the feet, the ankles, lower legs, upper legs, hips and lower abdomen are relaxed. Now move your awareness to the base of your spine and allow that low back to relax. Relax your middle back and relax your upper back between your shoulder blades. And now be aware that your entire body is relaxed, from the top of your head down through the tips of your toes. And using your imagination, allow yourself total body breaths. So we'll do this by going to the top of our head, and we're going to exhale from the top of our head down through the tips of our toes. And now we're going to inhale from the tips of the toes up through the top of the head. So take a few moments and allow yourself total body breaths where you're exhaling from the top of the head through your body, out your toes, inhaling from the tips of your toes, up through the body and out through the top of your head. Just a gentle rhythm of total body breathing. A little slower, a little deeper than you usually breathe. Using your diaphragm if that's comfortable for you. Now I'd like you to bring yourself back to the room, maybe wiggle fingers and toes. Deepen your breaths, one more big cleansing breath. And as you open your eyes, find the color blue in your room and focus on it. Now let's look for red. Find the largest object in your room. And now focus on a very small object and bringing yourself back to your own body, color of the clothes you're wearing, bringing yourself back into your own body and space and time. And so now I invite you to think back to our rating scale. And so now ask yourself, how relaxed am I now on a scale from 0 to 10? So I hope it has shifted upward for you. I hope you're much more relaxed than you were when we first sat down to do this exercise. So I wanted to give you some more vagus nerve hacks. So I talked about the vagus nerve innervating or affecting the muscles in our throat. So how can we innervate that vagus nerve? Yes, by doing diaphragmatic breathing, which I have listed down there, but other ways to do it. Humming, singing, we're activating these muscles. Gargling, chanting, laughter, one of the reasons why laughter is so good for us. And then I mentioned diaphragmatic breathing again, but prolonged exhalations is called 2-to-1 breathing, which means allowing your exhalations to be twice as long as your inhalations. So you may want to breathe in to a count of 2, exhale to a count of 4. Or breathe into a count of 3, exhale to a count of 6. It's entirely up to you, and it's at your comfort level. But 2-to-1 breathing allows you a greater sense of relaxation. So thank you for joining me for this presentation. I hope it was helpful on your journey to becoming more resilient. Thank you.
Okay, thank you, Renee, for guiding us through that material and joining us for today's question and answer session. We've had a number of questions come in, so we'll go ahead and get started with those. The first question is, how can one develop and build their own HeartMath practice on their own? So if they weren't with somebody to guide them through it.
Right. Yeah. No, great question. Thank you for that. I'd recommend that you go to the HeartMath website. I believe it's just simply HeartMath. I think they have two, heartmath.com and heartmath.org. But you'll be able to get to one of their websites. There should be training on there. I bet if you go onto YouTube, there's going to be some HeartMath practitioners that will also guide you through some examples of HeartMath practices. Great question.
Yes, and wonderful resources to look up on your own as well.
Mhm.
Another question about a HeartMath session is how long should it last when they're doing this practice on their own?
It depends on how practiced you are in just sitting with yourself. If this is something new to you, personally, I think I would make those sessions short, because if you try and prolong them, it just becomes frustrating for you to try and keep your mind and yourself quiet and in that space. So you can start out as short or as long as you want, but starting out short, especially if you're new to this, and then just naturally allow yourself a longer practice as time goes on. You can use this as your meditation. So if you want to turn that into a 10, 15, 20-minute practice, but I certainly wouldn't start out with that if that's, if you're not, haven't already had a meditation practice.
Sure, a good tip.
Mm-hmm.
A question about diaphragmatic breathing. How will diaphragmatic breathing benefit pulmonary fibrosis patients?
Yeah, another great question. I think one of the most beneficial aspects of diaphragmatic breathing is the ability to activate the parasympathetic nervous system by bringing your breath down and moving that diaphragm, like I explained, which triggers the vagus nerve to activate the parasympathetic nervous system, which is like pulling your foot off of the gas pedal. Going into that rest and digest. So it helps you to learn to control your reaction to the stressors in your life better. The other physical benefit to diaphragmatic breathing is just the physical process of opening up your lung space all the way down deep. So you're using every little bit of alveoli in your lungs to pull in as much oxygen to keep those alveoli open, so you're able to expel the carbon dioxide as well.
Okay.
Yeah, I think those are the two most beneficial options.
Okay.
Mm-hmm.
Another question that came in is, do you have any tips or techniques to help with those who carry their stress as tension between their shoulders? I think that's something so many people are wondering about.
Well, yeah, watch your posture. You're probably walking around with your shoulders wrapped up around your earlobes, right? So just learning, being very conscious of where your shoulders are, because I think we just unintentionally do that. The next thing I would do is I would schedule a massage for yourself. You probably have some pretty good knots and kinks in that space. And during the progressive relaxation exercise that I took you through, I hope you noticed that you were able to relax your shoulders. It's very hard to have a meditation practice or learn to control your response to the stress in your life if your body is tense. So just going back and going, from the top of your head down through the tips of your toes and relaxing every body part, and also notice how you're relaxing those body parts. I think most of us are unaware of how much tension we hold in our body. So if you just start with a practice of being aware of where you're holding that tension and allowing that tension to dissipate, hopefully in time you'll be able to realize that you're holding your tension there and you can dissipate that tension. But I'd start out with a good massage.
Noted.
Right.
I think everyone will take note of that.
Yeah.
Another question, I think this really resonates with a lot of our pulmonary fibrosis patients, is that often in pulmonary rehab, they're taught to concentrating on breathing in through their nose and out through your mouth. So how can one take what's taught in rehab and kind of complement it with some of these breathing techniques?
I don't know that it makes a lot of difference, breathing. And I know pulmonary rehab, breathing in through the nose, out through the mouth, that's perfectly fine. I think the important part of that is the breathing in through the nose. Okay. There's lots of reasons for breathing in through the nose, from cleansing the air to warming the air, coming in through the nose, to activating. We can activate our nervous system in this nasal passage, and that can also start that relaxation response. Yeah, so if you feel as though it works better for you to do in through your nose, out through your mouth, and that's your comfort level, I don't see anything wrong with that. And I typically teach in and out through the nose only, but again, it's also your comfort level. Yeah, if you're not comfortable, you're not going to want to do any type of a breathing practice.
Yes, good point. Thank you for clarifying that. There is a question that came up on earthing. Mm-hmm. Are bare feet essential to earthing, or can shoes be worn?
Right. So most of our shoes, I bet none of us have leather-soled shoes any longer. Our rubber-soled shoes do not conduct. So if we're on the ground with our our rubber-soled shoes, we're not going to have that negative positive ion exchange. So again, unless you have some natural soled shoes, or yes, you need to use your bare feet. That's where that ion exchange comes in. Good, great question.
Yes, and then another question that came in is asking about a comparison between a practice of yoga and I think some of these relaxation and breathing techniques. Is that something you'd be able to address for them?
Yeah, I think I saw that question. So which one's best? I think the best one is the one that resonates with you. Everybody's going to be different. Everybody's going to have different comfort levels. I would just recommend that you try some of them and find the one that makes your heart sing. And that's the one that you're going to want to continue with. I don't think one is better than the other.
Great. It looks like we have gone through all of the questions that we can address for the group today. Unless anything else comes in the meantime. Mm-hmm. Let me just double check here. Sorry, one other question that I missed. The question is phrased, I still have issues trying to breathe from my diaphragm. So should I concentrate on the other breathing techniques first?
So issues breathing from the diaphragm, it just takes practice. So I'd recommend practicing once, twice, as many times as you want during the day. So what that practice might look like is, so I mentioned wrapping your hands around the lower parts of your rib cage so you can feel your rib cage, and bending over and practicing that. Other ways that you can practice diaphragmatic breathing is simply laying flat on the ground. If the ground is daunting to you, on your couch, on the bed, turn your head, place a pillow or a blanket to protect your neck. And when you take a deep breath, important, put your hands over your head. So you're lying flat on your bed or the couch, hands over your head. When you're taking that deep breath, you should feel your belly push into the bed, the couch, the floor. You'll feel your rib cage expand, and you'll feel your back rise. So that's just a really powerful way to practice diaphragmatic breathing. Another way you can practice it is lying on your back. Place a heavy book, a pillow, something on your belly that you can feel, so that when you take a breath in, you're going to feel the book or the pillow elevate. And then as you exhale, you'll feel it come down, and you can also see it. You can see it go up and down. So because we've lost that natural ability, since we've grown up from toddlers, we've migrated to our breathing with our upper chest. So it just takes practice. So I encourage you to continue to practice. And what was I going to say after that? And other, breathing practices, certainly, whatever is comforting to you, whatever resonates with you, please go ahead and do that. But how important I've explained how important it is, as far as activating that vagus nerve and the parasympathetic nervous system, how truly life-saving it can be for many reasons to learn to breathe with your diaphragm.
Thank you so much for expanding upon that. I'm glad we caught that question and hope the information is helpful to all of you watching at home. We're just about up against time. So on behalf of Renee and myself, I want to thank all of you who joined us today and hope you found this information to be helpful to you on your disease journey. We do have some more sessions of Summit coming up and another day tomorrow. So please continue to join us for the remainder of the conference. And we look forward to seeing you and interacting with you on the platform. Thanks so much.
Thank you for your time, and I enjoyed being with all of you today.